A new deadly drug, 20 times stronger than fentanyl, is fueling the next opioid crisis. It's already in 30 countries, and there is no test strip that can detect it. By the end of this, I show you the exact death numbers year by year, why governments are failing to warn people, and a company is building a billion-dollar antidote market around this crisis. Nitazenes, they were invented in 1957. A Swiss lab called Ciba made them as painkillers. 1 milligram put a patient into a coma. They were abandoned immediately. Fast forward to 2019. China bans fentanyl production. Cartels need a replacement. And nitazenes? Their raw ingredients are used in common blood pressure meds and antacids. Completely legal. Impossible to restrict. So production shifted overnight. Now here's the scary part. Nitazenes aren't replacing fentanyl head-on. They're being mixed into pills. And users have no idea. In Toronto, 50% of street oxycodone had nitazenes. In Australia, 84% of patients who overdosed had no idea a synthetic opioid was even present. Fentanyl test strips cannot detect them. Standard drug tests cannot detect them. Seizures in Europe went from 430 tablets in 2022 to over 50,000 in 2024, a 116 times increase in 2 years. Deaths, UK went from 52 in 2023 to 195 in 2024, nearly quadrupled. Estonia's 52% of all drug deaths are nitazene related. And the US, at least 2,000 deaths since 2019. But the CDC doesn't even have a separate category for nitazene deaths. So every number you see is an undercount. So what have governments done to warn people? Almost nothing. No country has launched a single dedicated public awareness campaign about nitazenes. Compare that to fentanyl's one pill can kill campaign. The one exception? Ireland. After 57 overdoses hit Dublin, the HSE put up emergency posters across the city, issued red alerts, and formed a national response team. But that was a crisis reaction, not a prevention campaign. The DEA issued warnings. The UK scheduled them as Class A China banned precursors in mid-2025, but zero branded awareness campaign. Now, who's building the solution? The global Naloxone market, that's the opioid reversal drug, is worth $1.5 billion, projected to hit $3 billion by 2030. Emergent Biosolutions controls 75% of the market. They distributed 22 million doses in 2024. But here's the problem. A standard fentanyl overdose needs to 4 milligrams of naloxone. A nitazene overdose? Up to 6 milligrams. Some patients need continuous IV drips for 15 days. So the market is shifting to higher dose products. Indivior makes OPV, a longer-acting alternative with 5 times the binding power. Revenue target? 150 to 250 million. And the wildcard? ARMR Sciences just launched a phase 1 vaccine trial that blocks 92 to 98% of opioids from reaching the brain. If that works, game changer. Nitazenes are easier to make than fentanyl. Harder to detect, harder to reverse. And nobody is talking about them. This is not investment advice. Do your own research. Send this to someone who needs to know about this. This could save a life.